but then also reminding people how many of our elders have been lost in all communities, but particularly think about the African American community alone, how many esteemed elders have been lost. And a reminder to people, if you want to protect your own family, this is the only choice. Pretending that COVID's going to somehow skip by you isn't viable. And I think we really have to give people that passionate feeling.
Yeah. And Dr. Murthy, you want to jump in on this real quick?
Sure. Well, I couldn't agree more with what Tony and Mayor de Blasio said. Really spot on in terms of the information. I mean, this is a true miracle of science, what we've seen, the fact we have a vaccine this early, but we've got to listen to people and we've got to make sure they have the right information. I just want to say two quick things here. One is, I think the importance of listening here is so critical, because listening is a way of showing that we respect people. It's a way of saying, I see you, you matter, that you have value. And many people who are skeptical about the vaccine, are from communities that have for a long time felt very disrespected and devalued by society more broadly, by the healthcare profession, by the public health sort of apparatus. And so that's one of the most powerful ways we win back trust, is by taking the time to actually listen to people. It's a mark of respect. But the other point I wanted to make is about the messengers, because as important and powerful as the message is, and we've got to get that message out exactly as Tony put it, although I can never quite put it as eloquently as he does. But we also have to think about the messengers, and we need a variety of messengers to really reach everyone. There are times when, people like Tony and myself and Mayor de Blasio might be the right messenger, but there are many other circumstances where it's local pastors and rabbis and local nurses and doctors and other community leaders who are the right voices and right faces to be out there. And so I think part of why I think all of you are so critical as mayors is not only because you're on the front lines, it's not only because you're trusted voices on the ground, it's because you have relationships with so many of these trusted voices. And if we really want to make this vaccination campaign work, if we want to turn this pandemic around, we will need your help and your leadership in engaging with and mobilizing those trusted voices in your communities to be out there, sharing what they know about the vaccine, to be leading by example and getting the vaccine and then posting that video, posting that picture so others can see that they're going first and they're not just asking others to go on faith.
We're going to turn the page just a bit, and with cities of all sizes continue to be on the front line of fighting the pandemic and have requested flexible assistance so they can be a driver rather than a drag on America's recovery. We know that President Biden's always talked about building back better. The conference of mayors across the nation have welcomed President Biden and other federal leaders' support on this critical issue of direct investments in our nation's cities to expedite vaccine distribution, expansion of testing, tracing and isolation strategies, and keep our critical services and essential personnel running at full strength during this crisis, during this pandemic. From your perspective, I wanted to know, is this very, very important right now? We talked a little bit about vaccines, but I feel like we still have a lot more to do as well. This is a full comprehensive approach. We're going to be all in. What do you guys think? Dr. Fauci?
Yeah, I mean, obviously, something as extraordinary as the experience we're going through is not going to be addressed adequately by one element. And I think you correctly pointed that out, Mayor Stoney. I mean, a vaccine is absolutely critical when you have a global pandemic. But if you look at the other things that are involved there, the economic situation, the social situation, all of those other things, that's the reason why when you look at the plan, and we started off the discussion by talking about the national strategy that we had, the president's national COVID-19 strategy. If you read through it, it really touches on those other things that make it comprehensive that you alluded to and that Vivek described so nicely, a bit ago during the discussion. It's an absolutely critical part of it. So there's not one element that's going to get us through it. Clearly, as a scientist and as a person who helps develop vaccines, I feel strongly about the need and the importance of vaccine. But I also am modest enough to know that that's not going to do it alone at all. And that's the reason why you've got to look at all of the other elements that you alluded to.
Yeah, and I have to say, Mayor, this horrible crisis has been one of the most powerful proof points we've ever seen for why we need a universal health care plan for our nation. It's not just about everyone being insured. It's about the ability to get healthcare information out to people from trusted providers. That means we need everyone to have a primary care doctor, and we need people not to hesitate to get healthcare because of cost. The notion that we would have been able to do things very differently if every American had had real access to healthcare. I think this is going to be one of the conclusions that's drawn in the next year or two, that this crisis could have been lessened if we were not a country that rations healthcare according to income. So I agree that there's so much more than just vaccine, and we got to get through the battle ahead. But I do think there needs to be a reckoning going forward. If we don't want to see another pandemic, or if we want to fight back more effectively in the future, then let's have an honest conversation about how to get healthcare to the very folks who bore the brunt of the coronavirus crisis.
Dr. Murthy, that seems right up your alley right now. I mean, you're tackling the coronavirus right now, COVID-19, but you'll be responsible for even more beyond this once we get to the light at the end of the tunnel. What's your say on this?
Well, a couple of thoughts, and I couldn't agree more with what Mayor de Blasio said in terms of the importance of healthcare and coverage, and that's still a missing piece for millions of people in our country. And Tony's absolutely right that this is a multi-pronged problem that requires a multifaceted solution. That's why there's not one chapter alone in the plan that the president put out yesterday. There are multiple chapters because we've got to fight this battle on multiple fronts. But two things I'd say about local aid and local support in particular. One is that, I think the team really understands that state and local aid is absolutely essential, and it's a key part of this next aid package. It's because we know that this crisis has really forced state and local budgets to go into crisis. And at the end of the day, you're faced with dealing with the budget crisis, with making ends meet, with balancing that budget, figuring out how to pay firefighters and teachers and police officers and others. And this is, there are times when we're thousands of communities in 50 states. And there are times where we have to stand together as one nation and recognize that this pandemic is something we have to take on together. And a clear way to do that is to make sure that states and local communities have the financial support that they need. But the second thing I just want to mention on this front also is that there could not have been a stronger case for building and strengthening our public health infrastructure than this pandemic. We know that public health has struggled for many years. That's not new in the past year, but that budgets for public health were slashed during the Great Recession in 2008 and 2009. They never recovered, even though the economy recovered. And so you've got departments of health around the country that are still understaffed. They don't have the technology they need. And think about this, that when these crises like COVID come upon us, and we put out guidelines that testing should take place in a certain way, that contact tracing has to take place, that people have to be checked when they travel in or out of a community, the burden of doing that falls to local departments of health, as all of you know so well as mayors. And this is a time where we have to take a hard look and say, not only how do we support local government in the short term, but how do we rebuild these departments of health and our public health infrastructure for the long term? Because God forbid another pandemic comes our way in a few years, we cannot afford to be caught in the same position we are now, with an infrastructure that is fragmented, with data systems that don't talk to each other, with personnel that are overtaxed and under-supported, and with mayors around the country who don't have the reliable flow of resources that they need to address the crisis. That's what we have an opportunity to fix. That's how we use this opportunity to ensure that we are stronger post-pandemic than we were even before COVID arrived.
Thank you so much, Dr. Murthy. I know that is music to the ears of many, many mayors from around the country right there, and we build that sort of infrastructure up moving forward. I know there are a lot of mayors who want to jump in on the conversation as well. As I stated earlier, if you do, please use the Q&A box at the bottom of your screen. We're going to actually start pulling some of these questions out now because we do have a hard stop at 5:30. our first question is from Mayor Chris Bolwich from Elizabeth, New Jersey. If someone receives the vaccine within the waiting period, contracts COVID-19, what is the advice or waiting time for the second dose, or the doses, or does the person need both doses, and when would that start?
Well, we've had examples of that. And that's, not an easy question to answer because there is not a lot of precedent for that. But what we have said is that if you've gotten the first dose and you've contacted COVID, that you should go ahead and just get the second dose and not just stop off on that, because you probably had some protection against maybe the full effect of the COVID infection with the first dose, even though you weren't protected from infection. And what you want to do is to go and get the full level of protection. So it's an overlap of the natural infection and the vaccination. But I've gotten that question asked multiple times, and upon consideration, we feel it doesn't make any sense not to go ahead and give the second dose.
Dr. Murthy, you want to add anything there?
No, I think Tony said it. I think Tony said it all. And I think the key thing to keep in mind here is that, we're learning as we go, in this process, and we're assessing the data as it becomes available. And the commitment that, we're making is that we'll be open with the public as to what we learn, and we'll keep refining our responses, and our protocols along the way. But the bottom line is, and this is really important for just to clarify something that Tony has said many, many times, I know many of you have repeated to your constituents as well, is that you do not get COVID from the vaccine. And so I know some people are worried, gosh, if I'm sick right now and I get the vaccine, is that going to put more COVID into my system? Because we've heard these questions too. And the answer is no. What the vaccine does is it helps your body produce a protein that's a piece of the virus. So it can almost simulate a part of the virus, but not the part that on its own can go about making you sick. But it stimulates an immune response. It gets your antibodies, up and running, so to speak, formulated and produced in large amounts. And it's also worth saying that, some people have said, gosh, I've heard that people have felt worse after the second dose, that they seem to get more fever, more chills, etc. And while that is true for some people, I don't want it to dissuade people from taking the vaccine. If anything, what that tells us when you get a stronger reaction after the second dose is that's evidence of your immune system revving up even further and generating even more of those antibodies, so that if and when the actual virus comes and tries to attack your body, that you will have a lot of antibody, a lot of defense mechanisms already revved up, and you'll be more able to defend yourself.
Got another question here from Mayor Armin Mazzani from Keller, Texas. The question is, in my city, we have a good mask compliance and our schools and businesses are overwhelmingly complying with COVID guidelines, but we have incredibly high infection rates and are seeing record hospitalizations and deaths. My residents are asking me whether the guidelines matters. If so, many people are getting sick. How do we communicate the importance of these guidelines in saving lives as we wait for the vaccine?
Well, that's an interesting question that transcends the issue of COVID and protection against it. Just because you have a degree of infection and you're doing the right thing doesn't mean that doing the right thing is not preventing you from having an even worse situation than you already have. And that's tough to get people to appreciate that. And, that's one of the reasons why you have to keep showing that the scientific data show that there is a positive impact from the implementation of public health measures, the washing of hands, the wearing of masks. I mean, when people comply with that, what they may likely be doing inadvertently is that they may be in a situation that I explained a few moments ago, where they think they're in good compliance, but they say, well, I can't wait to get home, sit down and relax and talk with my friends because, they're my friends. They're not symptomatic, and not realize that someone who you may bring into your home innocently may have gotten infected with no symptoms, and then all of a sudden you have infection within the context of the home setting. And we've actually, as a matter of fact, Mayor Stoney, have realized that that is much more of a problem than we realized at first. Namely, is the setting of the home with friends, with some family. And that's the reason why you're hearing the recommendations that when things are bad, you should try as best as possible that in the home setting to not let anyone in except the people who live there all the time, unless you have a pretty good idea and confirmation that they themselves are being as careful as you are and have their own little pod in their family. Because often you are spreading infection inadvertently, even though you think you're doing the right thing.
And Mayor, let me just add quickly, no public official should underestimate the power of their own voice. So all my fellow mayors, I mean, you just heard from Dr. Fauci, who has been the single clearest, strongest voice in this country, saving lives, protecting lives. But every one of you as mayors has done that too and made a huge impact. I would say to every mayor, just don't stop. As frustrating as it gets, as much as sometimes it sounds like people are not listening, keep letting people know how much it matters to take those precautions, and particularly call them to their better angels. Because one of the things we saw in New York City, remember in March and April, we were in just the toughest shape. But we said to people over time, you know, the social distancing, the shelter in place, the mask wearing, we kept giving them more and more messages of what would work. And they did it. They were heroic. I always say New Yorkers were the heroes of this crisis because they answered the call. But we got to keep putting that call out there, you know, respecting people and calling them to arms to finish the battle.
There you go. I agree with you. I agree with you, Mayor. We got one more question before I'll let you guys get some closing remarks, and I want to give this to Dr. Murthy. So kind of give us some insight on how much communication do you and Dr. Fauci have with some of the vaccine manufacturers? I know you mentioned it earlier that there might be another one that may come along in the future. Do you two know how many they expect to have made and created in the next 2 weeks or next month? Do you have an idea or even a timeline? Is there some expected numbers that you can give to the public or to some mayors?
Well, thanks for that question, Mayor Stoney. And one thing I'll just clarify for you is, you know, Tony is currently in the administration and has been continuing his work. I'm sort of in a period where I'm still getting confirmed by the Senate. So there'll be a little time before I fully join on. But I'll tell you from my conversations during transition, and I think this is true for Tony and the rest of the team as well. We've been deeply involved in conversations with the companies on a very regular basis. And those were conversations that frankly started even before the election to try to understand just more closely what the supply was, what the challenges were, what the roadblocks were to getting even more supply accelerated, what the potential failure spots would be that we need to look out for and plan for. Those conversations, I think, have given us more confidence that there is more supply coming and that it will continue to steadily increase over the next few months. And part of what we've talked about also is the importance of making that data as clearly, available and transparent, so that mayors and the general public can also see, a lot of what we're seeing as well, and can have some confidence, about what the supply looks like over the coming weeks. One of the most clear pieces of feedback that we got from governors, and echoed, in many parts by mayors as well, was that they needed more information on when the supply was coming. They needed more than 4 or 5 days notice. That they needed ideally several weeks notice so they could plan accordingly and set up their operations. And we heard that loud and clear. So I think what you will see in the coming weeks is a greater focus on that transparency around supply, so that you have a better sense of what we're seeing, and also so that you have a sense of what supply also will be coming to your state over the coming weeks.
Awesome. I want to just end with, letting you all provide some closing remarks, but I just want to say what I've been saying here at home in Richmond since March, and that is this is the biggest team project that we will ever be a part of. And it's going to take everyone, whether it's our residents, our citizens, our elected officials at the local level, our healthcare officials, our frontline workers, the state, and the federal government is working together. Do you have any closing remarks, starting with Mayor de Blasio, for the mayors out there who are still in the fight and ready to go another few rounds so we get this thing, until we get this thing ended? Mayor de Blasio.
I'd say, I've talked to so many of my colleagues, and everyone's been through hell, let's be clear. But what I admire about the mayors of America who've been the frontline leaders in the fight against COVID is the amazing spirit, the just unwillingness to quit, no matter how bad it got. And sometimes we didn't have a lot of ammunition, but people kept going. So thank you. It's important, a lot of times I think mayors will all agree. The first thing we hear from the people in our city may not be the words thank you, but let me offer them to you to thank all of you for what you have done. But to our federal colleagues, God bless you for what you're doing. We could not be happier to be with you and to have our president and vice president now in office. I have a simple list that I bet a lot of mayors in America would agree on. One, supply of vaccine, supply. That's the number one concern right now, to maximize it so we really can reach our people quickly and not have to cancel those appointments. Two, stimulus, making sure the cities of America can get back on their feet and lead the national recovery. Three, that flexibility, that local flexibility. We know how to reach our people. Sometimes state and federal rules slow us down, and no one wants to slow anyone down, I know. But give us some flexibility. That second dose, giving us that freedom and flexibility around the use of second dose is a good example. It'll make a big difference on the ground, while we make sure, of course, everyone does get that second dose. Some flexibility on timing and conditions help us a lot. And four, thank you for using the Defense Production Act. Please use it to the fullest, because anytime the supply gets disrupted, we lose a chance to reach our people and save lives. I know you all know that and feel it, but you have the power we don't have to make the companies do what we need, and it could not be in better hands. So again, thank you all.
Thank you, Mayor. Thank you so much. Dr. Murthy.
Sure. Well, thank you, Mayor Stoney. I just want to first just say thank you all to all of you, not just for being here and giving us the opportunity to be with you and share some thoughts, but for the work that you've been doing from day one. This pandemic knocked on your doors nearly a year ago, and you opened that door, and you've been dealing with everything that's been coming through it ever since then. And I know that one of the reasons I love mayors is because not only are you just on the front lines, but you're deeply grounded in the realities of the day-to-day, that you can't retreat to a corner and just push off issues and defer them to somebody else. You are the folks that people on the ground look to for answers and for solutions. And my regret is that you haven't always had the answers that you need, the resources and support that you need. I hope that we can change that over time. I hope that you will feel more supported. I hope that you will feel like you have a true partnership in the months and hopefully the years ahead. But one last thing I just want to call attention to is something that you've also seen very clearly, and I just want to make explicit something that is implicit to you, which is that the toll of this virus goes well beyond the count in terms of number of deaths and hospitalizations and cases. But we know that there are invisible wounds that we have suffered through this pandemic, especially wounds to our mental health and well-being, which have already showed up, right, in rising rates of depression and anxiety. We've also seen rising rates of substance use disorders and overdose in many communities as well. Another manifestation, if you will, of the stress as well as the disconnection from treatment and resources that so many people have experienced during this pandemic. But I think there's an opportunity here for us all, because this is an opportunity, I think, for us recognizing how many people are in deep emotional pain as a result of this pandemic, to step back and realize that this is our chance to have a different conversation about stress and well-being and our mental health. It's an opportunity for us to double down on building the infrastructure to care for our mental health in our schools, as well as in our broader healthcare system. We know that so many children go years before their symptoms of mental illness are diagnosed, on average 10 years. We know that even when people have a diagnosis, getting treatment is really hard for a lot of folks in an environment where insurance companies often don't pay enough for that treatment, and when finding a good mental health care provider is really, really tough. And needless to say, if you're managing 3 or 4 jobs on top of that, getting that kind of care for yourself or your kids is almost impossible. But I think we have an opportunity, given how many people have struggled and how deeply this pandemic has hit us, to really have a different conversation around mental health, one that destigmatizes mental illness, one that I think ignites the fire that we need to have to put the resources behind mental health services. And hopefully we can come out of this with a deeper appreciation for just how deeply interconnected physical and mental health are. And the fact that it is in our mental well-being that we find some of the greatest resources for doing our work, for being there for our families, for performing in school the way we want our kids to. So this is an opportunity to think big about how we recover. And if we do this right, my hope is we'll come out of this pandemic with a better public health infrastructure, a better healthcare system, a recognition that we depend on each other, and a desire to listen to and cooperate with and build a relationship with one another, and a commitment ultimately to ensuring that we are caring for people's physical and mental well-being, because we need both. We can't afford not to focus on our mental health.
Thank you, Dr. Murthy. Thank you for your service. Looking forward to the next 4 years. And
you,
Dr. Fauci.
Well, thank you, Dr. Stoney. Well, ditto for everything that Vivek so eloquently expressed. I agree so deeply with everything he said. I just want to be really very brief and say I want to thank you all for giving me the opportunity to be here with you on this panel today. It was both a pleasure and really a privilege. I enjoy very much interacting with mayors and people who are really on the front line. I often have said, as recently as just yesterday and the day before, that the only way we're going to get out of this outbreak, this terrible scourge that we're going through, is that if we understand and deal with what is going on locally and in the trenches. And that's the terminology I always use, that you can be in Washington, you can be in the Situation Room, you can be in all the exalted places on the halls of Congress and talk about what goes on and what we need to do and whether it's going right or going wrong. But the place where it counts is in the trenches. And you guys and ladies are in the trenches. So it really has been a real pleasure to spend some time with you today, going in the trenches with you, realizing and experiencing with you what you're going through, because only by doing that can we be more helpful in that synergy that I mentioned the president is talking about when we get the federal government and the locals together in a productive way. So thank you for giving me the opportunity to share in that.
Oh, thank you, Dr. Fauci.
Thank you.
Dr. Murthy. Thank you all for your contributions today. And we look forward to having the lines of communication to be open over the course of time as well as we get through this pandemic. And thank you, Mayor de Blasio, brother. Godspeed.
Thank you all.
Take care.
Thanks so much.
Thank you.